right. I'm so glad this worked out. Give me just a moment, guys. Um, Sometimes things go not exactly the way you plan, but sometimes it goes better and you weren't expecting it, but you have to just get on board. Okay. All right. Sometimes the best laid plans are the ones you didn't prepare for. Thank you so much for joining me in the room with a special agenda. And tonight we'll be discussing something that is coming up, and for some people it's already started, and that is seasonal depression. And this is Wednesday because so many people don't know that these are things that we'll deal with. For some of us, as we get older, those of us that are the estrogen crew, okay, as you get older, you start to struggle with things that those chemical imbalances can cause depression seasonally. Um, as the seasons change, the amount of dopamine and estrogen, other hormones that keep our body balanced, and mental health balance, and us from wanting to self harm or harm those of us that are harming us emotionally decreases. And so it becomes a war with yourself, and sometimes what you're dealing with daily and what was seemingly small things some time ago in your life become bigger issues. The pants that was on the floor from your children, and them leaving stuff all over or leaving the milk out, which you could have let pass a couple of years ago, make you start plotting their path on out your door, or you wanting to give them the whipping they possibly too old for. And that is what it is. Sometimes it make you want to whoop your coworkers. Um, and that is what it is. But it is something that we have to learn to deal with. And those of us who have loved ones that we are now privileged to care for, um, whether it be our adult children or now our adult parents, our siblings, um, life is changing constantly. And being prepared for it and understanding that you don't always have the help you need, but sometimes it's available if we're willing to say a prayer and remember to be kind enough to seek it. Few things are more important than self love. I was having a conversation with one of my children and trying to help them understand the significance of giving yourself grace, because none of us are perfect, including us as parents, but also understanding that everybody that we want to see us the way we want to be seen, or be there for us in the way that we want them to be there for us, may not always work out the way that we hope. So it's important to see yourself as important. It's important to look for the good things in yourself. Yeah, it's important to seek out the things that we are flawed in and see how to correct those things. But it's more important to make a list of the things that we're good at and the things that make us a great individual. And while we're giving that information to our children or our mates or our friends, sometimes we become invisible to ourselves. Sometimes we don't feel like we're seen by others, but sometimes we lose so much of ourselves in our day to day privileges and responsibilities that we forget how important we are to seek out the things that we like, to give ourselves grace and understanding, and sometimes to seek professional assistance. Everybody is not fond of medications, but sometimes medications are necessary. Depends on where our levels are and what exactly we're dealing with. And it's okay to be honest about being depressed. Some of the things that we'll deal with is as we're getting older too, not just seasonal depression, but other things that pop up as far as mental health issues are concerned. Just like we check our blood sugar, and we may go see an endocrinologist, or we may need to see a cardiologist because we're struggling with problems with our heart and cholesterol issues, or other concerns that may be causing our heart to become strained because of the things that happen, even possibly genetically. We may need to see a pulmonologist because we're struggling with other issues with comes to adult onset asthma. I'm part of that group too. Who didn't know that was a thing, but yeah. But it's so important that we give ourselves the grace of looking out for ourselves. And by the way, you don't have to tell other people that you are getting help. If it's recommended by your doctor, it's recommended. Sometimes your boss will recommend it if they feel their life in danger, you know. It might be difficult, but some of the things that are happening might not necessarily be everybody else's fault as much as things are happening. As we get older, other mental health issues pop up. We may be late onset, find out that they have issues with being bipolar, um, dementia, Alzheimer's. There are other cognitive issues that they become more agitated dealing with, and not realizing those things or becoming concerning, or the mental health issues or diagnosis for other intellectual issues that we didn't know were things that we were struggling with when we were younger, and not being diagnosed and no longer being able to mask that or fight with it as much as we had been in the past and conceal it. Now it's coming out. And we need to do that for ourselves. If anything else we struggled with, we would get help with that. So why not that? Sometimes we'll see our friends and we know that their load is heavy. I'll say it again because I said it recently, and I will repeatedly say it. Please stop telling people how sorry you feel for them. It is not encouraging, it's not supportive, it feels insulting. Yes, they may be struggling with it. Yes, they may be ill equipped for it. They did not know that it wasn't going to go well. Just like so many other things in life that people walked into thinking it was going to go smoothly, and it didn't. No one wants to be kicked just because they were in your way. It's not encouragement. Yes, you may see that the problems that they're having and see that they are not seeking out the support that they need, or you can see them struggling with the other responsibilities they have, and the load is heavy. If you cannot be of support and you cannot direct them to support, help is not telling them how bad you feel for them. That's not help. That will never be help. That is the opposite of help. Because now you make them self-doubt when they already was doing that. They have enough negative conversations with themselves. Support looks like maybe giving them information or saying that you'll go with them. No, you may not need to sit with them in their doctor's appointment if they want it to be private, or if they're going to be seeing a therapist or a psychiatrist or a counselor. It may be, you know, taking them to the appointment and sitting in the waiting area, or going to run an errand and coming back for them if that's what they need, or just a hug, asking them how they're doing without judgment. A lot of people are concerned about the cost of it, but some insurance plans, even state insurance, does cover sometimes 100% of the cost of therapy. Sometimes we justify not going because we forget how important it is that we take the time, so we make excuses about not having time to do it. But taking the time is crucial to look into making sure that we get help. Um, and if you are a parent, a wife, um, a friend, a sibling that has added responsibilities, that is a part of your self care. That is a part of your wellness to make sure that you're okay. You don't owe it to just others to be okay. You owe it to yourself so that you start to feel better. Sometimes we hold on to such grief of the things that we lost as time went on, our expectations of what life would be like, sometimes the guilt of feeling bad or feeling overwhelmed or feeling inadequate, or sometimes failing at the role that we know we now have, falling short of being patient, that we punish ourselves by not seeking the assistance that we need. Yes, it's very important that we seek scriptural advice and prayer, but sometimes the individuals that are in position of spiritual assistance aren't trained doctors. So if you broke your leg, you would not go to an elder in your congregation unless there was a doctor or an, an ortho doctor. It is not wrong to get psychiatric assistance. Yes, they love you. Yes, they want to hear the things you're dealing with, but it's much more important, and it can be private, to go and seek the help that you need. If they're not seeking